Medical experts are sounding the alarm about a possible tripledemic that could unfold this winter. Cases of COVID-19, the flu, and RSV, a virus that's been putting children in the hospital, are all expected to rise. And this comes as a stunning number of healthcare professionals are leaving the practice, which could cause major issues for people who need care.
So Dr. Celine Gounder is here with us in Studio 57 to talk more about all of this. She is the editor-at-large for public health at Kaiser Health News and a CBS News medical contributor. All right, so we got two big topics to actually talk about. We'll start with sort of this triple respiratory threat. What are you most concerned about?
I'm concerned that hospitals, healthcare providers are going to be overwhelmed. I think we're looking at very high rates of both flu and RSV, so probably something around like 35,000 hospitalizations per week just from those two conditions. And then on top of that, of course, your COVID hospitalization. So are we going to be prepared? Are we going to have the beds? I'm really concerned about that.
So as we pointed out, there's been a dramatic spike in RSV cases among children, which is overwhelming pediatric hospitals. There isn't currently a vaccine for RSV. First of all, what is it? About to be apparent, Celine, you already knew that. What do I need to know about this?
And are children more vulnerable?
So with flu, RSV, and COVID now, the very young and the very old are the people who are most susceptible, who are most at risk for hospitalization and death. The reason little kids, especially infants under the age of 1, are so high risk is because, one, their immune systems are less developed, but also just think about the physics of it. Their airways are smaller, so if you have inflammation in the airway, so that tightens up the airway, you have mucus in the airway, it just makes it that much harder for a small baby, an infant, to breathe.
So where do they get it? Where do they get it? How could, if you have a newborn at home or you have some baby who's under a year, is it from being out? I mean, is it transmissible like that, or?
It's contagious.
It's contagious.
So it's spread, through contact, through respiratory exposure. So there's a reason moms are so protective of their newborns because they realize, people touching and kissing and so on, sometimes there's risk with that.
Yeah. So let's shift gears a little bit and talk about the other thing that we brought up, this exodus of healthcare workers. We've brought this up before. During the pandemic, people complain about burnout, but they sort of stuck it out because they got into the medical industry for a reason, because they want to care for people. But I imagine now that, we're kind of on the other side, that people are just like, I've had enough. I need a break.
So what we've seen over the course of the pandemic is you have some people who get burned out, they leave the profession. Then what's left behind? It's an even more difficult situation, even more understaffing. So then more people get burned out and leave. And what we've seen is over the course of the pandemic in the past year, some 330,000 medical professionals, which includes nurses and other types of professionals, have left the profession. Essentially, we can see it in the billing. They stopped billing. They stopped seeing patients.
Are they leaving the profession or sort of going into other areas like out of hospitals, a different less demanding type of care?
There's a lot of things. You have some people who are just taking early retirement. You have some people who are deciding, I'm not going to work in the hospital, I'm going to see patients in clinic. You have some people saying, I'm going to move into administrative positions, but not seeing patients. And so, it's all different kinds of ways of reducing that burnout, of having a better work-life balance, which frankly, over the last couple of years, it's been really hard on people.
So what are the implications of losing so much staff in an area, and specifically in areas that are perhaps underserved?
Well, I can tell you what I'm seeing at Bellevue, where I work. Patients are sitting in the emergency room for a day or two waiting for a bed because we don't have, it's not just about having the physical bed. You need to have the doctors, the nurses, the other staff to man that bed. And so patients are having to wait longer. And then on the other end, when we're trying to discharge people, nursing homes are also seeing massive shortages of staff. And so we can't send people out, people who need maybe a little bit of time getting rehabbed or are going to a nursing home long term. We can't send them out. So we have to have them sit in the hospital that much longer. So the whole system is really clogged up right now.
This whole idea of work-life balance is actually not just a conversation that's happening in the medical field. It's across the board after the pandemic. And and to the point where, you can throw as much money as you want at people. That's not what they want, right?
That's a great point, Anne-Marie.
Yeah. So then how do you fix this? Because my sort of first instinct is, well, just pay them what they're worth. But I don't know if that's enough.
I don't think that's enough. And after all, time is money. I think people are valuing their time in a whole different way now. And I do think it would require really rethinking the business model of healthcare, really changing how, we structure healthcare, how we deliver it, who provides it. I'm somewhat skeptical that we're going to make those changes.
Yeah. If we do, it'll be maybe too slow.
That's right.
This crisis is now.
Such important information. Dr.
Yeah.
Celine Gounder, thank you as always. We appreciate it.